Referring to the same trial, that same quantum R randomized trial, obviously it had a nice response rate. Now, we know that you can get resistant to Quizartinib if you develop a tyrosine kinase domain mutation, but this was really more looking at, was there something about the mutational profile at baseline that might predict a response to Quizartinib, or was there something about the mutational profile that might predict for a longer survival? In that, so it really wasn't so much focusing on the mutations that emerge causing resistance, which is really kind of another issue in the field. It's what predicts for response. And the mutations that we saw were kind of the typical ones that you see with FLT3 ITD patients, DNMT3A, TET2, and I thought the intriguing one was CEBP alpha. CEBP alpha is not one that we equate as being one of the more common mutations, and there are actually some interesting interactions with that mutation and FLT3. Perhaps not surprisingly, a patient who had a CEBP alpha mutation at baseline had a longer overall survival. It tends to seem to predict for a more indolent disease. You then also had correlations of what we call the allelic burden or variant allele frequency, how much FLT3 mutation you have at baseline. So a patient who has lots of FLT3 at baseline is much less likely to respond to chemotherapy than to Quizartinib compared to a patient who has a low level of ITD at baseline. And that's, this was kind of reassuring that this is all behaving as we expect. So I think that's more or less what, I think the CEBP alpha is the most intriguing finding out of that abstract.